1 out of 3 people will get cancer in their lifetime, and 60% of people treated for cancer suffer from long-lasting effects. Cancer is characterized by single or several tumors growing in the body. But what is a tumor? A tumor is a clump of fast-growing cells in the body. There are multiple ways to treat tumors, including surgery, radiation, and administration of drugs. One way to treat a tumor is to administer chemotherapy. Chemotherapy is a drug that kills fast-growing cells. However, chemotherapy does not only attack cancer cells, it attacks all fast-growing cells it comes across, even the healthy ones. As chemo spreads throughout the body, healthy cells are killed as well. This causes many of the common side effects of chemotherapy, such as hair loss, anemia, and a weakened immune system. But what if there would be a therapy that only attacks disease cells? Would that help with these side effects? And is that even possible? The answer is yes, it might be possible. Reducing side effects could be done by activating chemotherapy at the tumor. This way, most of the healthy cells will remain unharmed. A chemotherapy that can be activated only at the tumor is called Photoactivated chemotherapy, or PACT. To learn more about this technique, we went to Leiden University to speak with Sylvestre Bonnet. His research group is currently studying photoactivated chemotherapy.
So the idea of photochemotherapy is that you make a chemotherapy molecule that is going to be light activated with the idea that you wait until the chemical is in the tumor of the patient. In that stage, the molecule should not do anything. It should not have any biological activity, so that if it goes somewhere else, it also doesn't do any harm. And then you shine light inside the body on the tumor, and by doing so you activate the chemotherapy compound.
But how exactly does light activate this drug? The drug consists of two parts, a protective part and an active part. The protective part prevents the active part from attacking cells. When the light hits the drug, the bond between the protective part and the active part breaks. Now, the active part is free to attack the cancer cells. The rest of the drug circulates throughout the body, but does not do anything. So we can break bonds using light. But what light is used to break bonds, and why?
So there is a short answer for that, and that's red light. And that all has to do with penetration of the light. So you can do a simple experiment where you hold a flashlight on the palm of your hand, and you'll see the back of your hand glow up red. And this small thing shows that red has the best penetration through the body because all of the other light is absorbed by the compounds that are present in your body.
So red light is the best. But how do we get this light to the tissues? For skin cancer, this is easy. A red light can directly be shown on the skin tumor. But for tissues deeper in the body, this is not possible. A solution here would be to insert multiple optical fibers into the tumor to deliver the light. This way, even large tumors can be treated. PACT is not the first chemotherapy that is activated by light. There's another form of chemotherapy called photodynamic therapy. But what makes PACT different from this technique?
What exists in the clinic is called photodynamic therapy. The basic principle is the same, so you need a compound which absorbs light. You need light to be shown on the tumor, but you also need oxygen, because the photochemistry is related to the activation of oxygen with the molecule when the light comes onto it. So when there is a lot of oxygen, it works very well. And PDT, so this photodynamic therapy, really works very well with very low side effects for the patients in the clinics. And for some form of cancer, it's already proved. For a lot of other forms of cancer, it's in clinical trial right now. And our photoactivated chemotherapy does not involve oxygen at all in the activation mechanism. So this is why we are developing it for tumors which are low in oxygen, which have a low concentration of oxygen.
Because chemotherapy only attacks cancer cells, the side effects of chemotherapy are reduced. Also, it might remove the need for surgically removing an entire organ. So, PACT might result in a less invasive treatment for cancer patients with minimal side effects. However, it's only in the first stage of research. Much has to be done before this treatment can be used in the clinic. But what exactly has to be done before this treatment can reach the clinic?
the first thing is the development of the drug, because there is no ideal drug that can reach the clinic at the moment. So that's one. Once this will happen, once it will reach the clinic, one of the disadvantages is that certain specialists have to be trained in a specific way that they can do these therapies.
So far, Sylvestre, Bonnet and his group have developed a PACT molecule that works in a mouse model. However, it is still in a very early stage of research. Much work still has to be done before patients can be treated with this therapy. It may still take 10 years before PACT might be available to the patients, but at least there's light at the end of the tunnel.